Hi, this is Dr. Bhargava, and in this short video, I'm going to share FDG PET-CT studies in patients who have Alzheimer's disease, how to do the interpretation, and what are the findings on amyloid or F18 floor beta peer scans in patients who have Alzheimer's disease. So here we have two MIP images from two separate patients, and we are looking at FDG studies of their brain. On the left, I'm going to play the rotating image from a normal study. And so my point here is whenever you're reading a brain SPECT or a PET, always look at the rotating image and also look at the rotating image in a color scale, because that enhances the abnormalities and helps you make the correct interpretation. So let's take a look at it one more time. The most intense structures in the brain are the visual cortex that we see right there, followed by the subcortical nuclei, and followed by the rest of the cortex, the frontal, parietal, temporal lobes, and also the occipital lobes are pretty active, and the activity is normally symmetric. Now let's take a look at this patient on the right, which shows characteristic pattern of Alzheimer's disease on FDG PET. So here's the rotating image. And here you can see that there is parietal and temporal hypometabolism seen right there and right there in a symmetric fashion. And the rest of the cortex is pretty much preserved except for the frontal lobes, which are showing hypometabolism also, and that can be seen in late stages of Alzheimer's disease. So let's take a look at this scan in more detail. So here on a different color scale, what I've done is taken snapshots in the anterior, right lateral, left lateral, and posterior projections. So let's start with the anterior. There is bilateral frontal hypometabolism. Like I said, this is seen in late stages of Alzheimer's disease, and through that hypometabolism, we are able to see symmetric uptake in the subcortical nuclei, which is normal. On this right lateral projection, we find hypometabolism in the right parietal and temporal lobes, seen right there in a band-like fashion extending from superiorly to inferiorly and anteriorly, and there is preserved uptake in the occipital lobes or the visual cortex, and there is some uptake in the cerebellum. The same thing is seen on the other side. In the left lateral projection, the left parietal and temporal lobes show hypometabolism, and the uptake right next to it anteriorly is a sensory motor cortex, which shows preserved uptake. Subcortical nuclei are somewhere there, which we saw earlier, and then normal uptake in the occipital cortex. So this combination of finding is consistent with Alzheimer's disease. Let's take a look at another kind of study, which is amyloid PET scan, also performed as a PET-CT, and the radiopharmaceutical there is F18 floor beta peer. The market name is amyloid, and here what we are looking for is whether the gray-white differentiation is preserved or not. So on the top, I have three images in axial projection from superior to inferior, and we see that there is not much uptake in the gray matter, but there is uptake in the white matter. The ventricles are going to be photopenic, so that's what we see here, going from superior to inferior. And in the patient with extensive amyloid burden, look at what happens to the gray-white differentiation. It is lost because there is radiopharmaceutical deposition or uptake in the gray matter, and there is physiologic uptake in the white matter, so the gray-white differentiation is lost in patients who have amyloid deposition or amyloid plaque burden, and the images at the bottom are from a patient with Alzheimer's disease. Thank you for watching.